This is a young 30-year-old, very healthy gentleman who came to our burn center after sustaining a burn while he was involved in a motor vehicle collision. He came in with about 20 to 30% TBSA. He had face involvement and then bilateral upper extremities and bilateral lower extremity involvement. On hospital day number 1, we actually took him to the operating room. In the operating room, we debrided his wounds. When I'm doing a debridement on cases that I'm hoping to use RECELL, I use the Nexus device, which is an ultrasonic curette that allows me to have a wound bed that I can kind of tell whether there's adequate bleeding in the dermis. We sprayed this patient, focusing on making sure that his face had good coverage with RECELL and also then on his extremities. My protocol is always to leave the dressings alone. On the face, I leave the dressings alone for 5 days, and on the extremities and torsos, I leave the dressings alone for up to 8 to 10 days. We do sometimes apply bacitracin over our non-adherent layer just to make sure that the wound bed stays moist. And so these pictures that you're seeing here are going to be the pictures on his first takedown on his face and also on his arms. And you can see on his arms and legs that you're already starting to see his pigmentation returning in little islands. This is our follow-up of this gentleman at the 3-month mark to show that he really has an organic return of his natural skin pigmentation, no evidence of hypertrophic scarring, and a really nice cosmetic outcome, also with the ability to decrease his wound care and pain from prolonged healing. And I think one of the things that I pride myself in is being able to see that we have burn survivors who had burns on their face but kind of go back out into the public relatively soon with really good outcomes on their faces.